I'm Murad from Yemen, 56 years old. Actually, since 2019, I discovered, or actually the doctor discovered that I have Budd-Chiari syndrome. That time I start to search. Actually, I don't know what meaning Budd-Chiari syndrome. I try in Yemen, then in Saudi. At the end, I know some friend here in India came here. I met Dr. Markarjan. At that time, he told me what meaning and give me some medicine. And he tried to open the block. Budd-Chiari syndrome, as the doctor after some time he will explain, it's like block the vein inside liver. After that, I came 2 years, 3 years, 1 year to Dr. Markarjan and Dr. Sunil to recheck. Until this year, I'm feeling some pain and there is water, actual fluid in my abdomen. I returned back here to Dr. Markarjan. He advised me to come to Dr. Utaba. That time, خلاص, I'm feeling very bad. And because I make before one surgery, they try to make dips. I'm feeling very bad. As I told Dr. Markarjan, he advised me to go to Dr. Utaba. I came here. Actually, in one day, he told me, come tomorrow. In one day, he make surgery. He opened so many blocks. And the second day, he told me, you can return back to my home. Thank you very much for Dr. Utaba. And I'm very happy, actually. Thank you very much.
Thank you. What I would like to share is that we are the team of interventional radiologists at Glen Eagles Hospital in Richmond Road in Bangalore. We're very grateful that Mr. Murad was guided to us for a problem which is unfortunately very under-recognized. We call it Budd-Chiari syndrome. Essentially, there is good amount of blood coming to the liver, but the blood is not going out of the liver. And that is essentially what we call as Budd-Chiari syndrome. And this diagnosis many of the time is delayed. And luckily for Murad, he is intellectually very competent to understand the problem. He's able to reach to doctors. And he also has a genuine belief in doctors from India. Whatever advice we give him, he's taken it on board. And even though he and his family had some doubts as to how to address the problem, we were able to explain to him what are the options given his current condition. In the liver, when the main veins are blocked, we always try and see if there are any new veins. For example, if the main tributary is blocked, like in a river, you will have side tributaries opening. Similarly, in Murad's case, his imaging showed some what we call as collateral or a side branch. And when we went into that vein, we were able to see a narrowing. And we felt, given his current condition, we should just open that vein to improve the blood flow. So essentially, what we did was a venogram and a venoplasty to give him the best chance in opening up the outflow of the liver. We feel that we have achieved a good technical result. Luckily, we didn't have any complications, which is luckily rare. And he has tolerated the procedure well. He's gone back home, and very soon he'll be traveling back to his home country. We will obviously keep in regular follow-up and continue to be on his medication. And one final message I want to share with anybody listening to this video is, if ever you have a liver problem, which is called as Budd-Chiari syndrome, especially with fluid accumulation in your abdomen, you should make sure that you take an opinion from an interventional radiologist who will be able to guide you better in collaborating with the hepatologist, the liver surgeon, keeping the patient's main interests as the primary importance. So with those few words, maybe I can ask Murad, what would be your message for any patient out there thinking about what to do about Budd-Chiari from your perspective?
Actually, the first things the patient, he have to think, what he have to do very fast. If you flow with the doctor fastly, and he will guide you what you have to do.
Correct.
If you leave it for few time, maybe will suffering much and much and much. And second things, you have to follow what the doctor, he will advise you to do, which medicine, food. This is the second things. You have to follow and take that.
Correct. So I think what he's trying to say is that if you have a problem, you reach out to the doctor, follow the advice, which I think, he's a living example of that. In your own language, to people in the community, what would you want to say in your language so that it reaches to a large number of people who may not, fully understand English?
Yes, السلام عليكم. أنا مراد من اليمن. اكتشفنا عام 2019 إن عندي مرض يسمى بادكياري. حاولت أتعالج في اليمن، بعدين في السعودية. ما فيش كان أي فايدة أساسا، ما عرفوش إيش الموضوع. They told me you have to change your أنت ضروري تغير الكبد حق. سافرت مباشرة للهند لأنه أنا عندي ثقة في الأطباء في الهند، قد جربتهم قبل كذا يعني. وصلت للهند عام 2019 سبتمبر، والتقيت في دكاترة هنا المستشفى، وجابوا لي العلاجات في نفس الوقت، والحمد لله إلى الآن 2025 أو نهاية 2025 رجعت عندي المعاناة، شعرت مي وانتفاخات في البطن، ورجعت للدكتور نصحني أروح على دكتور صراحة ممتاز جدا، ما أقدر أصفه إلا بأفضل واحد بالهند. هو سوالي العملية وفتح كثير من التسددات داخل الكبد، وخلال يوم واحد أنا سويت العملية البارح، لسه آثار الفتحة هنا، وبكرة أنا راجع بلد. شكرا جزيلا.
Thank you. We'd like to once again take this opportunity to thank Mr. Murad and Mr. Fateh, who has been very helpful in
Yes.
looking after him when we are not there. So thank you one and all. So remember once again, if you have a bud carry problem, then you should reach out to an interventional radiologist who will definitely guide you and help you in your management. Thank you.